Welcome. I'm Doug Morgan, and you're listening to Uncommon Sense, where we hunt for the truth in the topics you're not supposed to talk about, Christianity and politics. A Colorado woman bled on the emergency room floor while waiting 12 hours for care. A New York man who feared he had an appendicitis waited 8 hours while repeatedly vomiting and passing out. A cancer survivor in San Francisco waited 28 hours for a doctor to examine her injured leg. By the time she saw a doctor, she was paralyzed, according to the Daily Wire. ER wait times have been steadily increasing ever since 2012. And of course, they spiked hard in around the coronavirus pandemic. But today, they're higher than ever. What is happening in America's healthcare system? I thought Obamacare was supposed to fix everything. Well, let's take a look at how Obamacare turned out, can we? The Paragon Health Institute took a deep look at what Obamacare has done. And what it has done is it has broken the 12 promises. There were a dozen promises that Obamacare promised. And we're going to take a look at those today. There were 7 million canceled plans and hundreds of billions of dollars in debt. First of all, promise number one, the ACA, which is Obamacare, would help cut the deficit in part by the restructuring student loans. Yeah, right? President Obama pledged that he would not sign legislation that would add a dime to the federal deficit. He called the ADA, Obamacare, deficit-reducing healthcare reform that would be saving over $200 billion over 10 years and more than $1 trillion in the second decade. President Obama doubled down in 2015, insisting that Obamacare is not a budget buster. There were 4 large projected savers. Number 1, large Medicare spending reductions. Number 2, large new taxes and higher existing taxes. Number 3, budget gimmicks such as the class program. And number 4, student loan provisions. Of the 4, the large Medicare spending reductions have persisted some. Both reductions in payments for Medicare Advantage plans and reductions in hospital productivity adjustments. Most of the significant tax increases have been repealed, particularly in large bipartisan votes. And this includes the health insurance tax, the Cadillac tax, the Medicare device tax, and the individual mandate tax, which was all in Obamacare. Moreover, the employer mandate tax penalty is collecting only about 5% of what it was expected to raise. There are 2 major ACA, or again, Obamacare taxes that remain. The net investment tax and the Medicare tax. The net investment tax is a 3.8% tax on net investment income. And the Medicare tax is a 0.9% charge that applies to all wages and self-employment income over $200,000 for individuals and $250,000 for married couples. There were also several budgetary gimmicks in the Obamacare thing, including the Community Living Assistance and Support Services, or CLASS program, a voluntary long-term care program designed to have years of collections before any payments would actually go out. There's actually been some that are at the state level as well. Although the program was poorly designed, it was scored as having budget savings 1 year after Obamacare passed. Secretary of Health and Human Services, Kathleen Sebelius, announced that the administration would not implement CLASS. The next year, Congress repealed it, so it was gone. It's just gone. Obamacare pay-fors included Student loan provisions. Now, this gets interesting, right? Accepting the premise that a government-administered loan program would be cheaper than its private sector predecessor. The Congressional Budget Office, that's the CBO, projected that federal student loan programs would reduce direct spending in the federal student loan program by $58 billion over the 2010-2019 period. Already by 2019, the CBO acknowledged that, in fact, the federal government's programs created by the Obamacare program would have losses of nearly $32 billion, not $58 billion in savings, $32 billion in losses. And then came the Biden administration. Yeah, and their mass forgiveness programs, which of course they did despite what the Supreme Court did and said. Supreme Court ruled that this was not constitutional, and they did it anyway. And what did it cost? It cost almost $410 billion more, according to the American Enterprise Institute. Nationalization of student lending, or originally enacted as a revenue source, has now become a mechanism for a vast backdoor expansion of unpaid for federal spending to subsidize higher education. That's promise number one. Promise number two, that the Obamacare program would bend the cost curve, saving $2,500 per family. Remember this? Right? Every family was supposed to basically not have $2,500 go out of their budget. Well, because of its benefit mandates for insurance and its pricing rules, the Obamacare significantly increased individual market premiums, which more than doubled from 2013 to 2017. Even factcheck.org, okay, which is a very leftist type of organization, called this promise one of Obama's whoppers. Moreover, plan deductibles soared, while the number of hospitals and doctors accepting coverage declined. The main Obamacare component intended to put long-term downward pressure on premiums was the Cadillac tax. It was an excise tax on high-cost employer-sponsored health plans. The tax is why experts such as David M. Cutler forecast that Obamacare would help curtail the growth of private health insurance premiums. But the political will for implementing the tax was always really weak, and the initial legislation delayed the tax 8 years. Legislation in both the 2015 and 2018 delayed it for several years more, and Congress repealed the Cadillac tax in 2019. So how about the promise that Obamacare would save lives? Remember that one? Well, as the ADA's key provisions took effect in 2014, life expectancy fell 3 consecutive years for the first time in nearly 100 years. President Obama promised that Obamacare would save lives and reduce injuries. Democrats in Congress touted a Harvard study concluding that 45,000 excess deaths occurred annually among persons aged 17 to 64 due to the lack of health insurance, preventing that many non-elderly deaths would noticeably increase life expectancy, right? Well, the figures show that life expectancy did not increase after 2014, which is when the ACA began enrolling the uninsured into health insurance plans. Instead, after increasing an average of 1.5 years per decade before 2014, life expectancy declined from 2014 through 2017. Life expectancy worsened in states that adopted Medicare expansion, Obama Medicare expansion, from 14 to 2017. That's relative to states that did not adopt the expansion. So by now, It is well known that the opioid epidemic, uh, categorized on um, categorized on death certificates as a type of injury, believe it or not, began to slow the growth of life expectancy after 2008 and turned the trend negative after 2014, as illicit fentanyl flooded U.S. markets. And while focused on touting and implementing Obamacare, the Obama administration and Congress failed to notice this leading driver of reduced life expectancy. The ADA itself included provisions that helped fuel the opioid epidemic, although likely to a lesser degree than prescription subsidies through Medicare Part D and the Obama holder late 2013 change in criminal sentencing policy. But let's look at another one promise. Obamacare would be a program only for U.S. citizens. By 2004, just last year, many unauthorized immigrants would be enrolled in subsidized Obamacare exchange programs. President Obama addressed a joint session of Congress in 2009 and said that there are also those who claim that our reform effort will ensure illegal immigrants. This, too, is false. The reforms I'm proposing would not apply to those who are here illegally. In a break with decorum, Congressman Joe Wilson, he was a representative from South Carolina, Republican from South Carolina, he shouted out at that point, "You lie." And you know what? Mr. Wilson is now correct. While the Obamacare continues to limit Obamacare insurance subsidies to those lawfully present, the Biden administration, of course, interprets that to include persons who immigrated illegally as children or the DACA recipients. Therefore, Obamacare statute has proven to be a mere recommendation for who receives subsidies. Enrollment fraud is so rampant that in some states, the number of people receiving extremely large subsidies in low income categories exceeds the number of eligible people in that category. By the nature of the fraud, unlawful subsidy recipients do not report who they are or why they are eligible. Presumably, some of them are ineligible because they do not meet the lawfully present requirement. So, again, another promise broken. How about this one? Obamacare would take the stress out of shopping for health insurance. Well, Obamacare portal was one of the most notoriously unreliable websites ever launched. Now, this is really simple. It's a website where you can compare and purchase affordable health insurance plans side by side, the same way you shop for a plane ticket on Kayak or something like that, right? The same way you shop on a TV for a TV on Amazon. Barack Obama said this very thing on September 26th of 2013, within hours of its launch. On October 1st, 2013, the Obamacare website experienced major issues. It crashed within 2 hours due to high traffic. On the first day, only 6 people successfully completed enrollment and selected health insurance plans through the website. The Obama administration launched the website without proper build and without proper testing, and it took nearly 2 months after launch for it to become functional for enrollment. Importantly, the back end of the website, which was supposed to verify information and ensure program eligibility, was left unfinished. The initial website budget of $93.7 million ballooned to an ultimate cost of $1.7 billion due to the extensive fixes required. In 2024, that's last year, as a result of expanded subsidies and Biden administration mismanagement, hundreds of thousands, if not millions, of people have been enrolled in exchange plans without their consent or switched from plans they selected to other plans without their consent. What a debacle. So, how about the promise of penalties on employers that fail to provide health insurance and that would provide significant revenue? Well, actual collections are a minuscule fraction of what was projected. Under the employer mandate, businesses with 50 or more full-time equivalent employees are liable for penalties if either they fail to offer health insurance or any of their full-time employees qualify for subsidized coverage on the health insurance exchanges and did not receive offers of affordable coverage from their employers. Actual penalty collections by the Internal Revenue Service have been far below CBO projections. 11 years after Obamacare was passed, the White House Council of Economic Advisors found that the IRS had collected only, get this, 1% of the projected revenue from the employer mandate penalty. These results are just absolutely miserable. For example, CBO projected $9 billion in revenue for 2016, but the IRS assessed only $0.42 billion and only collected $0.14 billion. Yeah, instead of $9 billion. Another promise that didn't live up to what was touted. The ACA, Obamacare, would increase economic growth. The ACA, Obamacare, has resulted in smaller businesses, fewer full-time jobs, and significant disincentives to work. President Obama asserted this quote, "You're not going to meet an economist who says that repealing Obamacare is a number one priority in terms of boosting growth and jobs in this country, at least not a serious economist." Well, his chairman of the Council of Economic Advisors, Jason Furman, promised substantial economic benefits from the law, including, quote, healthier, more productive workers, reduced job lock, and better macroeconomic performance, unquote. Well, Obamacare, however, was designed to penalize large employers if they did not provide health insurance, at least as long as Obamacare was expected to do so. Employers were incentivized to both reduce employment to avoid being designated as large, right? And to shift workers from full-time to part-time so they didn't have to pay them health insurance, right? A 2020 research article concluded that the ACA increased low hours involuntary part-time employment by 500,000 to 700,000 workers in retail accommodations and food services. I mean, that's enormous. In addition to disincentivizing some employers from expanding their workforce, the ACA also discourages workers from taking and continuing full-time positions as the subsidies for health and exchange plans decrease as household income increases. The CBO acknowledged this additional disincentivization in a 2014 report. So let's go on to the next one. Medicare would be an efficient way to increase coverage. Well, Obamacare Medicaid expansion is extremely expensive, with a much greater cost per enrollee than expected. This policy is consistent with the original intent of Medicaid, and it is the quickest and most cost-effective way to cover every American living in poverty. This is what Senator Max Baucus, he was a Democrat from Montana, said in November of 2008. According to John McIndoe, who documented the Obamacare enactment efforts and was a top Senate staffer at the time, CBO, quote, estimated much higher costs to cover individuals through an exchange rather than Medicaid because the latter pays medical providers much less than private insurers can get away with, and because Medicaid administrative costs are so much lower. Well, the ADA had two components of its coverage expansion: Medicaid and the heavier subsidized exchanges. The Obamacare expanded Medicaid to able bodied working age adults with income below 138% of the federal poverty level, and made income related subsidies available to people with income above 138%. In the in non-Medicaid expansion states, of course, and below 400% of, again, the federal poverty level to buy coverage in the exchanges. The authors of Obamacare repeatedly went back and forth with CBO to meet coverage and cost goals. Well, CBO's methodology, which turned out to be deeply flawed, is the reason that President Obama abandoned his pledge not to include an individual mandate tax penalty, because CBO estimated that the individual mandate would cause many people to enroll in plans who would not need subsidies to do so. Thus, more coverage with less cost. The reason that that Obamacare split the coverage expansion into a Medicaid component, and the private exchanges is that, per CBO, it would have been much more expensive to cover lower income Americans with subsidized plans in the exchanges than with Medicaid. So the vast majority of people who gained coverage because of Obamacare enrolled in Medicaid, causing a scholar at the Brookings Institute to refer to Obamacare as the Medicaid Expansion Act. 60% fewer people enrolled in the exchanges than CBO expected. 60% fewer. It turns out, however, that the Medicaid expansion has been an extremely costly and inefficient coverage expansion. The per enrollee cost of Medicaid expansion is nearly 60% greater than what experts predicted. And on average, the federal government is spending more on the per enrollee cost of Medicaid expansion than on exchange subsidies for the lower income consumers. Medicaid expansion has proven much more costly because CBO and other experts failed to anticipate how states would react to the high federal reimbursement rate to cover states' costs for expansion enrollees. So, yeah, again, another promise broken. So how about if you liked your plan and doctor, you would be able to keep them? Everybody remembers that one, right? Millions of people had their plans canceled and lost access to their doctors because their coverage did not meet Obamacare rules. If you like your healthcare plan, you'll be able to keep your healthcare plan, period. No one will take it away, no matter what. I mean, that's what President Barack Obama said on June 15th of 2009. Perhaps the most famous statement during the selling of Obamacare was, if you like your plan, you could keep it. This statement was named PolitiFact's Lie of the Year in 2013, as at least 7 million consumers saw their plans canceled in the fall of 2013 from Obamacare. The reason was that the plans did not comply with Obamacare's new mandates. In an interview with NBC's Chuck Todd on November 7th of 2013, President Obama apologized for misleading the American people and pledged to take action. His administration then released a grandmothered plan policy, which allowed insurers to continue plans that were no longer in compliance. This extra legal action was too little too late, as millions of people had already lost their coverage. Another wave of cancellations occurred in 2017 when the Obamacare administration, fearing that Obamacare plans would face too much competition, severely restricted short-term limited duration plans. This policy um, resulted in people facing hundreds of thousands of dollars in medical bills as their insurers were forced to cancel their coverage and they had no other option for coverage. As Obamacare severely limited the periods when people can enroll in coverage. The the Trump administration expanded Americans' access to short-term plans, but another wave of cancellations is still expected for this year due to a recent Biden administration restrictions. Well, President Obama also declared that people would not lose their doctors under this legislation. However, that proved not to be the case either, as a result of millions of people losing their health care insurance plans. Moreover, insurers, in an attempt to keep premiums from rising even further, created nearly very narrow network of Obama plans. These plans typically did not cover the best doctors and hospitals, leaving many people with coverage options devoid of their preferred providers. So, again, just another train wreck of a promise. How about the promise the individual market would become a competitive, robust market? Remember that one? Well, only about 40% of expected enrollees signed up for the exchanges. With their higher premiums, higher deductibles, and provider networks that were more restrictive than expected through 2020, enrollment surged in the past few years because of giant subsidy increases and a lack of income verification for subsidies. When selling Obamacare, President Obama spoke about the benefits of a competitive individual insurance market. Yet, Obamacare coverage proved unattractive, with only people who received large subsidies, or those who expected to incur significant medical expenses buying plans of any significant degree. As mentioned before, the vast majority of coverage gains as a result of Obamacare were through Medicaid expansions. Exchange enrollment has increased significantly and substantially over the past 3 years because the subsidies were made even larger. As a result of the American Rescue Plan Act and the Inflation Reduction Act, these subsidies now cover the full amount of the benchmark plan premium. So, again, another promise just absolutely broken. And how about Obamacare would decrease emergency department use as newly insured individuals would finally have a normal place for care? Well, Obamacare, particularly the Medicaid expansion, caused emergency room use to soar, particularly for non-emergency services. On March 3rd of 2010, a few weeks before the ACA passed Congress, President Obama said that, quote, taxpayers currently end up subsidizing the uninsured when they're forced to go to the emergency room for care. You can't get savings if those people are still going to the emergency room. A few months after passage of the law, then Speaker of the House Nancy Pelosi said that, quote, the uninsured will get coverage, no longer left to the emergency room for medical care. The expected opposite has occurred. I mean, the exact opposite has occurred. Numerous studies have demonstrated that Medicare expansion has significantly increased the use of emergency departments, particularly for non-emergency care. I mean, this was a main result of Oregon's Medicare experiment. A Brookings study found that 20% increase in hospital use for newly enrolled Medicare recipients, with the increase particularly occurring through emergency room visits for conditions treatable outside the emergency department. Another analysis on Medicaid expansion in California found a significant increase in emergency room department use and spending, even, with the increased utilization being driven entirely by those who replaced private insurance with Medicaid. You see, as a result of expansion, existing Medicare enrollees have had more challenges obtaining doctor appointments. And so what do? They go to the emergency room. And how about this one? Medicare would end abuses by health insurance companies. And what's been the result? Medicare has been a gift for health insurers with large government subsidies. In remarks to a joint session of Congress on September 9th of 2009, President Obama said this. He said, "What this plan will do is make the insurance you have work better for you. I would remind you that for decades, the driving idea behind reform has been to end insurance company abuses and make coverage available for those without it. I will make sure that no government bureaucrat or insurance company bureaucrat gets between you and the care that you need." President Obama decried that health insurance industry abuses, including rescissions, when making the case for the law to the American public. He also decried how insurers discriminate against people with pre-existing conditions. You remember that one, right? Well, in reality, Obamacare has been extremely profitable for the insurers, even after the individual mandate, which penalized Americans for failing to purchase their products, and that was repealed. The growth in insurer stock prices has multiplied between 2 and 3 times as much as the average increase of the S&P 500. I mean, we're seeing it all over the place. So those are the 12 promises that were made about Obamacare. And when you look at what happened from that point forward, from that point to now, you see every single one of those 12 promises completely broken. Obamacare has been an absolute train wreck, and it has taken a healthcare system that wasn't perfect and has made it so much worse, and dragging the insurance industry along with it. These type of things have to be corrected. This kind of stuff has to be corrected in order for us to even get back to where we were before Obamacare. This big government type of solution never works, and it was an absolute failure in this point. I mean, we as conservatives saw this coming. We said what was going to happen, and we're not, we weren't there just predicting the future. We were saying this is what happens when you take that big a chunk of the country's economy and you federalize it, and it has done exactly what we said it would do. And I would love to hear from you on it. And maybe you've been through some of this, and I would love to hear what your story is. And you can do that at uncommonsensepodcast.com. Thank you very much for listening.
This podcast is a production of Morganite Communications.